Welcome to A Way Forward, the podcast where I sit down and have real discussions about the challenges we face in our cities, communities, and neighborhoods. The goal of this podcast is to create a space that includes expert interviews, guests with lived experiences, and voices not often heard. I'm your host, retired Police Chief Daniel Hahn, and I will bring my experience in law enforcement, community, and education to each conversation so that together we can build a way forward. All right. Welcome, Dr. Flojaune Cofer, often known as Flo or Dr. Flo. So I'll just go with Dr. Flo today. I'd like to say a little bit about your background so people know who we have with us today. You're an epidemiologist and a policy director. She is running for mayor of Sacramento, a city that I am very fond of, and is one of only two candidates left on the ballot that will be at the beginning of November. Dr. Flo is the chair of Sacramento's Measure U Committee, which is an advisory board to the city on how to spend sales tax revenue that goes into the general fund and was approved by the voters in November of 2018. Dr. Flo has a degree in chemistry and women's studies from Spelman College and HBCU in Atlanta, Georgia. And she has a master's degree in public health and a PhD in epidemiology from the University of Michigan School of Public Health. Dr. Flo has also served with the California Department of Public Health and worked on statewide coalitions to decrease infant mortality and expand women's health coverage, and currently serves as Senior Policy Director at Public Health Advocates. So, and I know I probably left a ton of stuff out, but I wanted to make sure we highlighted that so folks know who's in the room today. But I always like to start off with talk a little bit about your upbringing and kind of what brought you to where you're at today.
Yes. Well, firstly, thank you for having me on. We had coffee a little while back and we had the conversation about coming on the show, and I really appreciate it. You will always be Chief Hahn to me, so I know that's not your title, but
that's all right.
Thank you for having me on, Chief Hahn.
I've been called worse.
You and me both. And I appreciate that because I think a lot of who we are is the story of our lives. And we had a chance for you to share some of your story. And so I appreciate the opportunity to be able to share it with your listeners and viewers. I am originally from Pittsburgh, Pennsylvania. And I grew up in the neighborhood that August Wilson wrote his Century series about. So the Hill District in Pittsburgh. And he is a hometown hero to us. In fact, his last few plays came out as I was, being raised. And my parents would take me to the Pittsburgh Public Theater to see them. And so that's a real source of pride. And it's one of the things that I think translates into my love for Sacramento and my love for some of the historic corridors, but also underinvested corridors, especially places like Meadowview and Del Paso. It's like I hear about the history in these spaces, and I think about the pride that we have in Pittsburgh in the Hill District, even when it was struggling, because August Wilson was writing about and telling the history and having something that we could celebrate. And that's always really important to me. And so I think it's important for people to know I'm from another mid-sized city with rivers flowing through it that struggles sometimes with its own self-identity because we're not Philly and people think we are. And we are constantly being compared in this way to the other cities in the same way that Sacramento has been. And so growing up there, I am the daughter of two public school teachers. My mom taught 8th grade English and my dad taught 8th grade math, and that is how they met. And so I
had no choice but to do homework that night.
No choice but to do homework. I had no choice. Everything was always a lesson. And I was just like, I just spent time at school and now I got to come home and learn about, everywhere we went, every vacation turned into we're going to stop by these historical monuments and we're going to learn the history of the space. And I'm like, we can't just go to Six Flags? Other families?
I just want to ride a ride.
I just want to ride rides. I just want to hang out with my cousins. Like, what are we doing here? But that's just the way that they operate. And they would always try to make it fun. But there was this part of like, here we go with the lessons again. So I had no choice. You're absolutely right. And my parents were really involved. They were, people who always rolled up their sleeves to be involved in things. My dad coached girls basketball And he and his best friend have rivalries to this day. My uncle will send me articles as he's going through his boxes where he beat his team beat my dad's team. They were so invested in these like girls. They'd be like, well, she can't dribble to the left, and her boyfriend broke up with her, so she you got to get under her skin a little bit, and she'll get riled off again. I'm like, you all are way more invested in this game. Like there's money on the line, right? You are middle school teachers. These are adolescent girls. And it's just so funny to me that was how they invested. My dad was really big on, I don't want you to ever feel like you're limited. I'm not wishing you were my son.
Think the fact that you were a young girl is part of the reason why he emphasized that?
Yes.
Because he saw
absolutely.
the difference between boys and girls and how society deals? Okay.
Yes,
good.
Absolutely. And he was like, I am, I'm not wishing that you were somebody else. I want you to be you, and I want you to feel limitless. And that was how my dad was. When my mom decided to go back to graduate school, my mom was like, oh, I don't know, and he was like, I don't want anybody to ever say you got married and you didn't do something. Like, if this is what you want, keep on with your goal. And so that's who my dad was.
Sounds like some of the same conversations I have with my two daughters.
Yes. So dads are important.
Yes. I could not agree with you more, being a girl dad myself.
Yes.
I read somewhere that, and maybe also you could explain what epidemiology is so we know. But I read somewhere that I believe your dad was probably, the experience your dad had with health issues is part of the reason why you went into that field. So maybe talk a little bit about that and what epidemiology is.
Yes. So epidemiology, the official definition is the study of the distribution, determinants, and conditions of the spread of disease in human populations.
That's a mouthful.
Which is a fancy way of saying we study why people get sick, why people are healthy, so that we can then say to people, hey, if you want to live a long, healthy life, here are some of the things that you can do to be able to do that. Okay. And these are the risks that you want to avoid, right? So everything from, we know people who have long commutes, who have to sit in their cars for hours, right? That has an impact on your health. We know smoking has an impact on your health. We know,
redlining, where they put it in contaminated areas. Yes.
Exactly. 20-year difference based on your zip code and based on the air quality and what you have in your community, all of those things. And so all of that comes from epidemiology. Is studying the data and being able to figure out what those patterns are. And it's different from medicine, but very complementary to it, because it's looking at the patterns of a population. Individuals can sometimes exist outside of that pattern, right? So you'll have somebody, there's always a story of the person who smoked and lived to be 103. They are an outlier. They are not the usual. Most people have a shorter life expectancy when they smoke, and maybe that person was supposed to live to 117 and only lived to 103 because they were smoking, right?
I hear those same stories about the kid that grows up in the impoverished high crime area that became, president of whatever. Exactly. See, if he can do it, anybody can do it.
And it's like, yeah, that's the exception. That's why we know that story, right? We know David and Goliath because David doesn't slay Goliath most of the time. And so that's really what epidemiology is about. It's like figuring out what is the most likely course, how do we maximize people's health, how do we minimize risks? And I did get into it because of my dad. When I was 11, we were at my aunt's birthday dinner, and my dad collapsed, and he ultimately ended up dying of heart disease. And he was
when you were 11.
I was 11. We were at Red Lobster.
So old enough to know him really well and be kind of conscious of who you are and your family.
And young enough never to know him as a man. And so it has really been a journey recently to talk to my cousins and my aunts and uncles and even some of his friends and get to know him better because, as a kid, you're very egocentric, right? It's all about me, right? I didn't even realize that my parents had a marriage because I'm like, they're here because of me, right? Like that, you're just starting to get to that because you're turning 12 and you're starting to like, having those romantic feelings about your friends and stuff. And they're like, oh, you two have that, right? And then my dad dies. So I didn't have a chance to really observe him as a husband. I didn't get to think about relationship. I didn't get to think about him as a friend. He was my dad and my mom was my mom.
And how did his health issue or collapsing impact you?
Yeah. So
go down that road.
I'm really glad you asked that because we found out my dad was sick over the summer. My dad was a very stoic guy, 6'3", big guy. And when he said he wasn't feeling well and needed to go to the doctor, something's wrong. And he was diagnosed with congestive heart failure. And about 17%, he was 47.
So really young
Yes,
for that.
yes. And 70% of his heart was working at that time. So he was placed on the transplant list, and he had fluid in his lungs as well. And so he was going through treatment. And so was then, of course, not able to return to work that fall. This was over the summer, because I remember I was at summer camp. And the interesting thing about being a kid is that I could recite his diagnosis because like that, I was good at that. But I didn't have the comprehension to actually understand what those words meant.
Right.
And so I'm like, yeah, my dad's on the transplant list, 17% of heart, he has congestive heart failure. And I think the adults around me assumed that I was able to put 2 and 2 together, but I'm 11.
Right.
So I had not. And so when he collapsed, I'm a Girl Scout, so I run and I call 911. Everybody else around the table, there were probably about 15 of us because I have a big family. And so aunts, uncles, cousins were all like a little bit freaked out. And thankfully, there was a paramedic at the table over from us at the restaurant. Immediately started doing CPR. Ambulance comes. But unfortunately, when we got to the hospital, he was pronounced dead. And a couple of things stand out about that experience. One is like, it is like watching someone die is really hard. And
Especially somebody you
hard
probably thought was invincible.
Yes.
At an 11-year-old girl
Yes.
looking at your father.
Yes, exactly.
Yeah.
I didn't, like, I'm saying the word and then I'm watching and I'm like, that was the first moment where like the words I was repeating actually had meaning for me, because now I'm like, oh, most of his heart's not working. Like we've just lost this person, and he's my dad. And my parents were a good balance of each other. My dad is the funny one. My dad is my mom is the more stoic one. Mm-hmm. And so it was like, I lost this balance in this moment. Right. And then my mom really struggled after that. And I think I'm just now, as I'm approaching her age, because she was 44 when my dad passed away, and I'm now just starting to appreciate, like, she lost the love of her life. And that was hard for her too at the same time. Sure. And so we were going through this together, and it just completely changes the way that you see the world, the way that you see yourself. And I'm really grateful. And I talk about this a lot, about how systems didn't protect my dad, right? Like,
and what do you mean by that?
Well, I mean that, he was born in 1947. So there was no Surgeon General's warning on that pack of cigarettes when he started. It was the cool thing to do. He smoked.
Like, yes. His whole life.
His whole life. And he struggled with that. I'm born in 1982. I was born knowing cigarettes are bad for you. Here's what they do, et cetera, right?
Yeah.
And so I would, badger him from time to time about, like, you got to stop smoking that. And he struggled with this addiction his whole life. And there was no smoke-free policies. Like, there were smoking sections in the restaurants and a smoking section on a plane, which is like really the plane.
I think we forget those times.
We forget those times.
Especially in California.
Absolutely, because I mean, California adopted smoke-free policies in hotels and, in restaurants earlier than everyone else. Right. And so that was, the lived experience that he had. And so those policies, if they had been in place, and my dad had been born in 1982 and not 1947, the statistics show he likely would not be a smoker, right? And he probably would still be alive, right? And so that's hard to swallow.
And that's really, if I'm hearing you correctly, that's really because the system switched the narrative, not only the narrative, but like the warnings and everything. Yep. So in his day, probably 90% of the people smoked. Like, it was the cool thing to do. It was no issues with it. In our day, it's rare to see
95%.
Like, you're kind of surprised when you see a chain smoker these days.
In fact, a guy came up to me on the street. This was probably a year or two ago, and he was like, "Do you have a light?" And I was like, only like 4% of people smoke, so you'd do better to find someone actively smoking and they have a light. Like, you're going to be asking a lot of people. I'm just trying to save you some time, right? If the person's not smoking, they probably, like, you're barking up probably the wrong tree.
They even had candy cigarettes when I was a kid, because we'd walk around with a candy cigarette because it was cool to smoke.
Yep. And so, so those were the policies and the things that didn't exist to protect him. And that I've had the benefit of, because they were put in place to protect us afterwards. But what I did end up with, and I'm really incredibly grateful for, is that my public school had individual and group grief counseling. And I had a Black man who was a member of Omega Psi Phi fraternity, who was my counselor, Mr. Galloway. And I did grief counseling with him. And he was able to help me talk about my feelings navigate this major trauma that I had just experienced, and connected me with other people who had a brother who died in a car accident and a mom who died from cancer. And like, we were this little cohort of
Which
kids.
is a little surprising that kids that age were even willing to go to counseling.
Yep.
Because if you had said go to counseling when I was that age, I'd be like, I'm not doing that.
They didn't even, I'm assuming there probably was an option, but maybe I was just the kind of kid who didn't know that.
Maybe they want you to know that.
They were like, come here. And I was like, yeah, okay. Like, this is what we do now. And then the only session I actually remember, Siobhan, is this one session where they asked us how we were doing. And every single one of us talked about somebody else in our family. I talked about my aunt and the other girl, like how they were doing. Like none of us talked, and he let us all go. And then he was like, none of you talked about yourself. So I'm going to ask this question again. How are you? And whatever the specific question was. And I don't know why that stands out to me, but it's something about how we deflect.
Coping.
And even as a child, we were all deflecting and not actually answering the question about how we were doing. We were experiencing the grief through someone else's eyes, and that was more comfortable for us than for us to be able to actually talk about our own emotions.
So here you are, have a education that is not super common in our country. Like you take the number of people that have PhDs in our country. I don't know what the stat is, but I guarantee it's very small because the bachelor's degree is very small.
Yes.
And you're working in the field of epidemiology. Then you are starting to get active in the community in Sacramento. And then I don't know if you lost your mind or what happened to you. But at some point in the last year or two, you decided to run for mayor. And I'll be honest that, well, first of all, I think the vast majority of people in this community didn't think you had a chance. And I will include myself in that. I'm like, is she just doing this for fun, or is she just wasting her time? Because the people that were in this race, the primaries, were all people that had either been on the city council already, or at the state capitol as a legislator, or both, and had a long-standing political history in our town, which means they have networks, they have funding. I don't remember specifically, but my guess is you're probably the lowest funded person in the primary, would be my guess, because these people had structures already. And so I was right with the crowd, like, she's going to come in 4th or 5th or 6th, or I don't remember how many initially were in the race. And then the primary happens, and you came in first.
I know, it's wild.
So not even 3rd or 4th, but first. So my first question is not how you finished the primary, but why did you even initially decide to run for mayor, and what made you think, and maybe you had your doubts too, I don't know, but what made you think that this could be a viable campaign in light of we're a political town, we always have been. That you could even be on the same level, not necessarily because you didn't have good ideas or were intelligent or anything, but because of what it takes to get elected. The other people had the structures in place and you did not.
Yeah. I mean, I think it's a great question. And yeah, I can admit out loud now that I had my own doubts. I got into this race really believing that Sacramento needs a change, that I'm a person who studies structures and studies what's happening, and I try to be very self-reflective. And I hope our conversation allowed you to see a little bit of that, of like, I go back and think about things because, yesterday is not today. And we have the benefit of if we're still here, we have the benefit of learning and growing and thinking about what we could have done differently, what other people could have done differently. And so one of the things I like to think about is I want to make different mistakes than the person before me, because that's the benefit of them having come before me. It doesn't make me better. It makes me benefiting from the fact that they've had that experience. Right. And so I feel like I watched and I asked a lot of questions, and I was critical at times because I'm an advocate, and my job is to, in that capacity, is to hold firm a line and really try to pull people in that direction. But I also, at the same time, have this experience in my organization of being on the executive leadership team. And as, part of that C-suite team, I'm not an advocate. I'm the administrator. I have the role of being able to bring people together and listen and support staff and set goals and do these things. And because I have that executive leadership experience, I started recognizing that one of the key things that seem to be missing at the city, we have a lot of people who have a lot of political experience, but the city also is a structure that has to be managed.
Sure.
And the mayor and the city council have multiple staff, the city clerk, the city attorney, the city manager, right, that they have to manage. And when I'm hearing things like they're not setting performance goals because the city hasn't set priorities, and I'm looking at my organization, which has, 1% of the city's, staff. And I'm like, how do you get anything done if you don't have these things in place? Because we have these things in place and we are so much smaller. I'm thinking about how we pull people together and identify their strengths and create a team out of people who are very different. I'm thinking about what are the policies and practices that we have in place and what are the political opportunities. And the things I saw were that we needed to be able to do more community engagement on a regular basis. And it felt to me like the office that was best set up for that was the mayor's office, because you have the most staff. And if you partner with the staff on the city side, you can really get a lot done. We have some great folks doing community engagement, and we can actually go out and listen. And so I'm seeing development projects being held up because people are using CEQA to be able to get things. That's the approval process for environmental protections. And people are using that to be able to try to get something for their community. And I'm thinking to myself, well, wouldn't it be great if we had already had those conversations so projects don't have to be held up? Because when somebody wants to do a project, you already know what they want. I'm seeing, obviously, the challenges with public safety and going, okay, what are the opportunities that we have here to be able to create trust, to be able to alleviate? Because I think the part of the conversation that doesn't always come up, because it's always this weird part that maybe doesn't feel quite right, is that I'm the daughter of 2 teachers. And so I think teachers and police officers, from a personnel perspective, have the same problem. They are the ones, if it has to do with kids, we give it to the teachers. If it has to do with response, we give it to the police. And they're not always trained. My parents were not trained to be social workers.
Right.
My parents were not trained in social and emotional learning. They were not trained to be foster parents. They were not trained to do all these other things. They were trained to do classroom management and educate your children in 2 specific subjects, English and math.
Not to mention, it'd be pretty hard to train them well in all of those.
In all of those
no time
things.
To actually work.
Exactly.
Training all the time.
And so as a public health person, I think about how we try to structure these systems in ways that we have multiple people doing things so that everybody can be, it's multidisciplinary, it's interdisciplinary, so that people can come with their strengths. But because we have funding already for teachers and for police officers, we ask them to do everything. And so as much as we can be critical at times where we see things that we don't like from our police department, there's also we're also asking them to do things that they didn't sign up for, that we didn't train them for, and that they probably go home feeling very, demoralized about. I've joked sometimes and said, we keep sending police out to be able to address homelessness, and I'm like, unless they're going to adopt someone and bring them home and live with them, how are they going to solve this problem with the tools we've given, right? So I think about these from structural perspectives in terms of, how do we set this up for success? And I'm hearing and listening, and I'm asking Mayor Steinberg, what would you do differently? And he said, sometimes I feel like I kept things a little too close to the vest. And I'm agreeing with that, having been on the outside. Like, there were opportunities where we could have collaborated to make something successful. And so I started putting together this list of things that I wish was different in the city. And shout out to therapists, because they help. Because I was like, I said, a lot of people have said, you should run for something. And I was like, I'm not going to do that. That's other people's dreams. And she said, let's bookmark that for next time. And she said, it's okay to say no to something, but have you fully explored it before you say no? And I said, okay. And she said, here's your homework, write down what you'd like. And I looked up on a Saturday afternoon after writing down just like observations and things I'd learned and what I'd like to do. I had 16 pages of ideas and notes. And I was like, there's something here. And so, yes, I had the same doubts. Is Sacramento ready for this? Am I the right person for this? Are people going to be able to see me in a different light, right? Like, I kind of have to be like Jay-Z, allow me to reintroduce myself. I've been an advocate, and I have been an outspoken, loud, maybe
yes, you have.
Sometimes effective, sometimes ineffective, right? We make mistakes, we do things. I've always tried as an advocate to be able to speak my values and to be an honest person. And that translates across the things. I try to be transparent. I try to let people know where I am, but also there's a different role. And so now I'm looking at, yes, I don't agree with everybody anywhere. And I say this all the time to people. None of us do. You don't agree 100% with your wife, with your kids, or with any of your coworkers, anywhere you've ever lived, right? And yet we still find a way to work together.
Right.
And I think that I try to lead with a transparency and an honesty. And I also try to create an environment where my staff know they can criticize me and they can say, I disagree with you. And I think that's honestly what our city needs.
Yeah.
Less than agreement, we need people who are willing to come to the table. When we were on the heat table, I'm always willing to come to the table. I'm willing to fight it out. I'm willing to, you know, to hear you out. I'm willing to listen to the data. I'm willing to try to find points of agreement, and I'm willing to stay there. The only group I won't meet with are hate groups. So the Klan and the Proud Boys are out. But if you're not that, I will sit down with you. We will have conversations, and I think we can build something. And honestly, more than agreement, more than ideological or philosophical agreement, I think in Sacramento, that's what we need. We need the ability to be able to bring people together who don't agree on everything, and to be able to say to each other, look, we don't agree, or look, it hurt my feelings when you said this, or I was really disappointed that you didn't. I really appreciated you saying to me, Flo, you never asked. Right? You never asked me what I was trying to do. And I was like, you know what? You're right. I was critical of things I saw. I was critical of things I experienced. But I also, here you are, a Black leader in Sacramento who's leading, let's be honest, one of the most fraught, you know, departments, right? Just historically fraught. I mean, the Parks Department doesn't have, I mean, redlining aside, does not have the politically fraught nature of a police department. And I have a vested interest in public safety, as we all do. I am a Black woman, you know, for those of you watching on YouTube, right? Like, and I did not take the opportunity to reach out to you and say, what are you trying to do here? And how can I be helpful?
Right.
And so that's something that, as I'm running for mayor, I'm also thinking about. I want to be honest about the challenges. I want to be honest about the goals, but I also want to be honest about the fact that I think we can work well together. And I want to be able to be in a position to maybe repair some of those harms where I didn't reach out and have conversations that I could have, because I had the skill set and the ability to do that. And I chose a different tack, and I could have done something different. And I want us to all be able to think about, we're different than what's happening at the federal level. At the federal level, when I read Project 2025, I think to myself, I don't want to live in the country that you were trying to build. Like fundamentally.
Right.
I knocked 25,000 doors in the primary. And whether you were in East Sacramento or Land Park or Meadowview or Del Paso Heights or Strawberry Manor, people said the exact same things to me.
I'm not
surprised. This is what I want to, right? So we have a level of agreement. And I don't want our national situation to be what I think might be heading towards a divorce, or, you know, like, because we don't agree on where we're going. But it does also help put into perspective that the fights we're having at the local level are solvable. Like, we actually can sit down with each other, and we don't have to be in this fight with each other and where we're unwilling to talk and unwilling to work together. We will not agree, but we can work together. And I think that's the difference that I want to bring. And I think people in Sacramento are frustrated with what has been, and not so much necessarily with the people, but just sort of the culture that's been there. And I'm watching and I'm seeing and I'm saying, I think I have the skill and the outsider perspective and also the insider knowledge to be able to help us do something different. And that's why I'm running for mayor.
Well, and me personally, I'll never give up on Sacramento. I love this city. And then, two, I think a lot of the challenges that Sacramento faces are not much different than every major city across our country, and the causes of them are often somewhat similar also. So last question on the actual process of election. You know, early on in the election cycle, I would hear the polls, and you were always near the bottom. Senator Pan, Assemblyman McCarty, past council member Steve Hansen were always, you know, in the 1, 2, 3. And as it went along before the primary, those started to change a little bit, but the top 3 were still the top 3. Your numbers were coming up, and I would hear from a very select few, hey, Flo is moving up. Somebody better pay attention. But then I would guess the old guard, or the the people that are normally in charge of elections and all that said, don't worry about it. Why do you think that it started like that, but it ended with you? What do you think was going on with the voters in this community that went from the polls saying basically you have no shot, because I would imagine you saw those same polls early on, to you not only had a shot, but you came in number one? What do you think is the cause of that?
Yeah, I think a few things happened. Timing matters. So I am the unknown. I'm the person who's never appeared on your ballot before. And so when given an option to be able to choose between people who you may have a relationship with, who you voted for in the past, and who you like, that's who you're going to choose initially. So, when the polls are coming out in 2023, months before the election, unless you're an insider, you're not really paying attention. And so you're like, oh yeah, I know that name. This is who I'm going to go with. Also, some of them were what we call push polls. And so push polls are designed, especially if they're sponsored by a campaign, to be able to make your candidate come out on top. And then, the right. And so like,
what exactly are you saying?
they're just, right. The way that they're worded and that sort of thing. And so I think because it's sort of like a reinforcing cycle, because people assumed I didn't have a shot. They also didn't take time to test my messaging. Right. I mean, I saw one of the early polls that said, I think the only thing they said about me was that I work in public health and that if elected, I would be the first Black woman mayor of Sacramento. Is that all I am? That's my message. Like,
I've heard those messages before. Exactly. He's the first Black police chief. Yes. I'm like, I think I got more than that
going. Right. And so I think that's part of it. Right. If you're learning about me as you're filling this out, that's not a compelling message to make you go, I'm going to go against someone I know and maybe I've worked with and whatever else to choose some unknown entity.
So, but how did that change to where ultimately, though, they did?
Yes.
Obviously, more people voted for you than other people.
Yes. So polls also are a small sample, right? We're talking about 300 or 400 people. And so what happened was, it was early before we had debates. And so now people got a chance to actually watch us on a stage together. And I have heard from so many people that the KVIE SAC-B debate, they went in either thinking they were going to support somebody else or completely unknown. And they walked away going, wow, she sounds different from the others. And I actually left that debate really worried and really upset with Scott Cyfrax, because I was like, the guy's got to talk so much more than me. And then he said, go back and watch it. It's because you answered the question on the first round that we didn't have to ask you 3 or 4 times to clarify. And that stood out to people, that we didn't have to do that. And so it wasn't until I started hearing from other people about the debate and about how influential that was an opportunity for them to hear from me in a way. And so what we did was relational organizing. We had 60 house parties between April and November, where people opened up their homes to anywhere from 20 to 40 people. And we got to sit around for a few hours and talk. And they asked me questions and I would tell my life story. And we got to build this together. I was out reaching out to people in the community and saying, hey, look, business leaders, I know I may have some ideas that are very different from yours, but what are your pain points and what's going on here? And I was incorporating that feedback into what we can do as a city. I'm sitting with them and saying, well, can we, right? Like, we're having this challenge, for example, with our convention center where, in order to come here, because we don't have one main hotel, you have to fill out like 24 contracts with all these different hotels. And I'm like, well, couldn't we put together a master contract so that people only have to do one? And people are saying to me, the cost of labor, of materials is so high with our construction. And I'm like, well, couldn't we do what the airlines do and come together and say, hey, they don't pay for fuel at the pump like we do, and the prices are going up and down. They say next year we're sending out 10,000 flights and we're going to negotiate this fuel price. Could we do that with our materials? And again, none of these are things that we've done already. I'm just coming and I'm saying, I hear you. That's a problem. What can we do about it? Can we set some minimums for how long the city can respond so that we're not paying extra interest because our response times are low and our projects are then going up price per door when we're building housing? How do we do these things together? And I think having those conversations that were generative, that were in communities, showing up in spaces. If you reached out and said, can we be on your podcast? Can we be on your show? We did. And so we got an intimate conversation with more people. And then we knocked 25,000 doors and we called 50,000 people. And we got out and said, we will be in community. We will answer questions and we will talk. And I think over time, that relational organizing, that, hey, here's a clip of Flo, I'm supporting her, will you do it too? That, it's the same thing. Like if you and I have the same, skin type, type and you tell me, hey, this thing really worked for my eczema, I'm going to go, okay, I know you. That's better than a commercial.
Right.
And so we were able to do that because of the trust that was able to be built. And we really reached out to those networks. And there are a lot of people who, again, don't agree with me on everything, but want someone to come in and allow us to be able to have conversations we weren't having before. Gotcha. And bring more people into the conversation. And I think a lot of people here have felt shut out because of how we've done things, because we post, our agendas on Thursday and the meetings on Tuesday, and nobody knew this thing was coming. And now everybody has to scramble to try to respond in 2 minutes and are like, couldn't this be a little different? And so when I'm sharing a vision for how we could do things differently, they're like, even if I have maybe difference, I like that structure. I like that change. And I think that those conversations started to happen about what we wanted as a future of the city and how we move forward. And I think that really created some momentum.
Good. So I want to talk now about what I think voters are most concerned about, and therefore our community should be most concerned about. And that is, come November, should you win the election and become the next mayor next year of Sacramento, what would be your biggest priorities as mayor? Because in case people, like most of the people, even in Sacramento, even though it's been this way my entire life and long before my entire life, people think the mayor runs the whole city, right? Like that it's a strong mayor.
Yes.
And it's not.
And so we voted against it 3 times. So not want that, and it's not happening.
And we'll get to that in a minute too.
I'm not bringing it back.
But what would be your biggest priorities that you would champion as mayor should you win the next election?
Yeah. So first, I want to focus on structure. And I know that's not the sexy part of it, but it's the important part. So I want to start with, can we sit down? Not can we. We will sit down as a council and set some priorities and set some goals as well. Because when we talk a lot about homelessness, it's the number one issue in our community, along with, housing. And no one can name what the goal is for this year. In a functional organization, everybody knows what we're moving towards. And then you also are able to line up your resources accordingly. So I always say to people, it's not fraud. People are like, where's all the homelessness money going? It's going out to things. The challenge is, are they the right things? And are they moving us toward a goal? And what is the goal? And how are we benchmarking our success? And so because I'm not ambitious in terms of wanting to run for something else, I'm okay with setting some goals and working towards them and maybe not hitting all of them, but everybody knowing where we are. So one of the goals I've set is, we have 1,500 kids or families with kids that are experiencing homelessness. And I'd like by the end of my first term for that number to be 0. And I am okay with the fact that striving for that goal may mean that we only get to 1,200 or 600. But you know what? That's better than 0.
Right.
And also, we now know where we've gone. We now have an ability to be able to say, okay, we got halfway there. So that means we need a little more time. Or how can we accelerate? Or how can we learn? How can we do what we call continuous quality improvement so that we all are a part of it, but also so we can celebrate our successes. Right. Because, you were in office when we had 2 years with no youth homicides in the city of Sacramento. And I keep going back to that and saying, why did we not have, those things that you have in like a construction space where it's like, it's been 300 days since our last injury on site. Why didn't we have one of those at every school in front of City Hall where we're championing our successes?
Gotcha.
And saying, this has been going, we're at 700 days. Can we get to 800? Can we get to 900? What can we all do to help? When you know what the goal is and when you're seeing the success, it motivates people to get involved and to be more involved in the process. And it allows you to create pathways for us to work together. So that's one of the things I want us to do, is be clear about priorities and goals, and then also set some goals for our staff so that they are accountable. And so our entire city is working together. Because what I've heard from people, and you probably feel this as well, every week and every day feels like we're constantly in crisis management mode.
Oh, yeah.
And if you talk to people who work in an emergency department, what they will say is, the people coming in are in crisis. We are not. This is our job. We come here. I have my coffee breaks. I do my thing. Like we have a thing. Like we're not in crisis, but you are. And that's why you're here, because we handle you in crisis.
Right.
And our city should not be in crisis, even if there are crises happening.
Right.
We should have a functional system where people know what they're working on and they're not holding their breath Tuesday to Tuesday, waiting to see what are the whims of the council and how are they going to change moment by moment. And is the project I've been spending 6 months on suddenly going to be shelved because the council decided to pivot in a different direction?
Yeah, and I think part of the outcropping of that is, you mentioned the couple of years with no youth homicides. What I often saw at that time, which was frustrating, were actually different groups competing for, I'm the reason why we had no youth homicides. And I'm like, there's no one group that was the reason why we had no youth homicides. And there's also luck mixed in there, right? And there's also good doctors that mixed in there. It wasn't like we had no kids shot.
Right.
We had no kids died.
Yes.
And so I want to touch a little bit on you mentioned homelessness. And one is families and kids, but those are not typically the groups that are the ones called on, right? So, and they're usually the ones that are easier to help, right? If they don't have mental health and drug issues or other issues, like the resources needed to get that person back on their feet and going into where they want to go are easier than people that have multiple issues that are fueling their homelessness. So, two questions. First, we just recently had a U.S. Supreme Court decision that appears to have reversed what people thought Boise was, because there's a lot of disagreement on what Boise actually was, including in the city of Sacramento, that says that you can enforce your camping ordinances, if you will, where many people felt that Boise decision from a few years earlier said you can't. So how do you, and I've since heard the mayor say that we're basically going to stay the course regardless of that Supreme Court decision, but I also hear frustrated people in our community celebrating that decision, that now we can clear that sidewalk or clear this campment that's blocking my way or in my front of my house or in my business. And I can tell you there is a lot of frustration. I might be naive, but I don't think I am on this topic, but there are people that are frustrated that initially, several years ago were sympathetic and like, hey, let's get these folks help. But as they see the years go on and the camps grow or the issues around their home or their business grow, now they're frustrated.
Compassion fatigue.
And now they're like, okay, I just want you to get rid of them. Whereas, a couple of years ago, they were like, yeah, let's try these programs. And so with this new one, what are your thoughts on the Supreme Court's decision, and how do you think that will impact at all, if you were mayor, your what you would champion in regards to dealing with, I guess, the whole homeless or unhoused kind of circumstances in our city?
Yeah, so I'm going to bridge from how you started, because you're absolutely right about, first and foremost, about the fact that the kids and the families are often the easier ones to tackle. And so
let's tackle them.
Yes, let's tackle them, right? For a few reasons. Number one, because we know about life course and how those early experiences, if we don't do right by, can set people on a trajectory, right? It's the same thing when we see our kids in foster care, when we see kids who are struggling with reading and math, right? We know what that means. And so let's tackle it early, because an ounce of prevention is worth a pound of cure, right? And so it's really helpful. What's that Frederick Douglass quote? It's much easier to build strong children than to repair broken men, right? So wanting to think about how do we mobilize around some of the folks that, if we believe they're easy to care for, let's clear them and care for them. So that's one thing. And it also, I think, again, having some success there allows us to be able to mobilize a bunch of folks to be able to work on that. And you're absolutely right. So when I sat down and talked with the business improvement districts, and Bill Knowlton brought together 12 of them, we all sat down with the Mac Road partnership and having this conversation.
Heard some frustration.
Yes. And also what we heard was, that's a great goal and we're on board with it. How also do we deal with the folks who, like you said, and so that's the other side of that goal, which is, I want to deal with the easy stuff. that's also a long-term investment because we often don't think about prevention. And so if we don't, then we end up also creating cyclical issues.
Sure.
And I think we can also dedicate some resources to the several hundred people who are hardest to reach. Because what I have observed, and this is now me in the learning mode of the campaign, is our neighborhood associations know these folks by name.
Mm-hmm.
Our PBIDs know these folks by name. Our city staff know these folks by name. And our county staff know these folks by name. And so we're all in touch with and can identify folks. And so the question becomes, and these are the people who we sometimes refer to, and I think you've talked about this, the $1 million people, right? Because between our emergency departments and our jails and staff time, we are probably spending $1 million a year on them. And for much less money, we could actually braid together some of our existing programs to be able to get home health care so that they have 24-hour care if folks really need it, that we can get down payment assistance that can be paid through CalAIM, which is part of Medi-Cal, where we could get housing for them, right? This is a smaller number of people. And what that does is the same thing that working with the kids does. It allows us to have some successes that people can feel and see and experience. And it also then allows us to be able to, that early success can beget future success. And the challenge there, before you jump in, the challenge there has been, how do we do that? Especially when people will sometimes say, I don't want housing or I don't want the services, or I don't want
whatever
trust,
you're
right?
offering. Yeah.
And so part of it is approaching the conversation from the perspective of what is it that you need. And the reason why I say that is because during the limited time that I have done outreach, and my sample size is small, so I will always, but I've never had anybody who actually told me no. I thought at times I did, but what it turned out was there were pieces of the puzzle I didn't know. There was either a trust factor and it took some time or something. And so I had a gentleman who told me no to shelter, and I marked him down as refuse services, right? That was how that was going to go. But luckily I was in that area several days a week for a few weeks. And at the end of maybe 4 or 5 weeks of just, checking in, dropping off stuff, just how you doing, whatever, he finally revealed to me that he had his daughter with him, and his daughter was like 10 or 11. And he was, taking her to school, doing those things. But he didn't say to me when I asked him about the shelter that he had a daughter, because he didn't want me to know, because he was worried about, about CPS getting involved.
Same reason why the Hispanic community doesn't talk to the police department, because they're worried about deportation.
Exactly.
Maybe not even for themselves, but a cousin.
But somebody, exactly. And so he knew that the space I had offered was an open access one, which meant sex offenders and other people could be there. And so he wasn't going to be able to bring his child. So he told me, and no, it wasn't that he wasn't willing to go inside. It was like, he knew what I was offering wasn't going to meet, and he didn't trust me enough to tell me the full story. And so every time I've had that experience where somebody says no to me, I just wonder, if I had a little more time to build trust, could I have figured out why they were saying no? Because the no is actually the least interesting thing about someone's position. It's knowing why. And so I feel the same way when we start talking about how to deal with homelessness, and people go, gosh, Grants Pass is here. Great. And I'm like, what are you concerned about? And they're saying, I don't want needles on my street. I don't want my pathway to be blocked. I don't want somebody screaming at me or threatening me on the way. And those are valid concerns.
Which leads me to my next question. Those same people, whether they're business community or somebody that this is in front of their home where their kids are, or family are,
sleeping in your backyard, as what happened
or on
to
their
me,
porch, right,
less than 2 weeks ago.
So when I listen to you, I feel like I've heard some similar type things from officials that we have in place now or in the past. And as the years went on, I think the frustration that builds is people like, that sounds great. And that sounds like, okay, we'll have these services and we'll, help these folks with whatever their issues are. Could be mental health, drugs, or other housing, whatever. But that also doesn't sound like it will be in place tomorrow, right? Like, these things sound like they take time to build up. And I think mixed in there is, I've heard this for 3 years and I haven't seen it build up. But I'm dealing with this now in front of my business, and I've dumped my life savings into this business. And now, because of this issue in my area where my business is, I've lost customers. And now I've lost my life savings. And now I'm thinking about, maybe I should go to Folsom or Roseville or Elk Grove or somewhere where I don't necessarily have to deal with this at this level. If you were mayor, how do you speak to those folks that are like, that might all sound great, But even if it does come to fruition, it's not coming to fruition tomorrow.
Right. Yes.
And I'm dealing with this today,
Yep.
and I'm going to lose my business, or I'm not going to make the money I'm supposed to be making. I can't support my family, which to me are all very valid concerns.
Very valid concerns.
So what do you say to those folks? Because that's what,
yeah.
I'm sure you've heard that.
Yes,
right? That's what we hear every day.
Absolutely. And that's, I think, one of the reasons why, as a city, we also have to have some SMART goals, because it can't be for forever. Right now, we've said, we're going to work on this. And the question is when?
Right.
How much patience are you asking me to have? Right. And so
you've already been asking me to have, the people who come before you.
Exactly. And so I'm saying, if let's talk about targets. We're talking about the 150 or 200 hardest to reach folks who we know by name and who we are spending a lot of resources on. Let's sit down together and talk about with them, right? Like, also, nothing about us without us. Let's sit down and talk with folks who know them and think about, what is our approach? What is our timeline to build the trust? What are the questions we need to ask? How do we get people into the services? Because there's a way that we've all touched these folks, but we haven't done it in a coordinated way. And we haven't really thought about, what do we know? How can we best serve folks? Some of these folks are not going to be able to necessarily, right now where they are in their addiction or their mental health, be able to participate in their own care. But is there a plan for when they are able to, how we build that? And also, what do we already know about them that can help us, right? So how can we do that? And like, literally having a goal of, we have 150 people. We'd like all of these folks to be in housing and care by the end of the year. Like, I want a concrete goal. So at least, as we're working towards it, we can say, okay, we're 25 people in. Great. Okay, now we're 60 people in. Or we didn't get there. Like, and what happened? And also, now that we can say it's 150 people, I can say to you, Chief Hahn, okay, how much money are we putting behind this? Who's working on it? How are we coordinating? How do we do this together? And I think that's been the missing piece. It's been very amorphous. We're going to do something about this soon. Don't worry, it's coming. And we haven't gotten specific to, what are we going to do with how many people, by when, how, and how are we reporting back out, and how can you be a part? Because, Chief, honestly, the thing that has frustrated me the most is that no one, in the same way that I said to you, you know what, I never reached out and asked you, how could I be, like, what are you trying to do and how can I be helpful? I also think that's a cultural thing here, where the way that we do stuff doesn't inspire people to show up and say how I can be helpful. It inspires us to show up and say, I support this, or I hate it, right? Yeah. But at no point do we ask people, hey, you live in this community, you care about this issue, how can you help me with this? Right. I want that to be the first and foremost question that we're asking about all of these things, because government can't do it alone. Absolutely. And the nonprofits can't do it alone. And the business, clearly we can't do it alone, because we're all trying right now. So
we do. I think we've become very divisive, which is also an impediment to that. Yes. But to your point about even when we say no, if we're in the homeless community, that like there might be other things to that. But I also think there's a lot of people that say no because they're not currently in their right mind. And if they were in their right mind, they would not choose to live the way they are. So they are literally saying no, but it's because they have drug issues or mental health issues, or often both. Yes. And so they're not really in their right mind. So what is your opinion on things like Laura's Law, or I guess more generically, the ability to essentially, against their will, put certain people that meet certain criteria into services? Because I'll tell you, my opinion is we do need some sort of something like that, but it has to have the appropriate checks and balances so it doesn't get abused either way. Yes. Because it will get abused on both sides if it's not. But what I see is a lot of people that are not going to accept those services, that are not going to accept the housing, because they're not in their right mind at the moment. And those are the people that are in front. Those are the ones that get called on because they're acting abnormal to what people that see as normal, and it's detrimental to my business, or it's detrimental to what I feel is the safety of my neighborhood. Those are really the people we're talking about, absolutely. Right? We're not talking about the person out of sight, out of mind, or the family that, there's probably people that would be more willing to help that family living in a car than that person that's talking to the tree in front of their house because they're scared of that person. And so how do we deal with that, with the people that truly are saying no, but it's really probably because they're not in their right mind at the moment?
Yeah. So of course, we have things in place, and I have lived experience with this. My mom's brother, my Uncle Bubby, who passed at the beginning of May, has schizophrenia and was diagnosed when he was in the Air Force in 1968 or 69. And so, we're talking about, back in the day dealing with mental health as, a Black family in Philadelphia. And that was a real struggle for my entire family and continued to be really up until, recent years when my Uncle Bubby's health started to decline in other ways. And when he was not on his medication, he was everything you just described. Right. He would wander away from housing that we had secured from him, and we had to search for him, and sometimes would find him in the jail, and sometimes, for trespass, and like all kinds of things. And so you're absolutely right. We have gone through this, and I have had lots of conversations with my mom and my aunt about what we're able to do legally to be able to be his guardian and to be able to provide care.
Because there's a lot of families that are frustrated because they want to help, but they can't.
Yes. And my grandmother's solution, and God rest her soul because she passed away a few years ago, was she would put his medication in his coffee in the morning. And now that's something she could do because she was his mother and he lived with her, right? And that's not something that the state
and she was still around him,
and she was still around
to a different city.
Exactly, exactly. And so, and so that was something she was able to do to be able to get him stabilized and keep him stabilized. And so I think the key question is, these are folks, again, who are known because there are multiple points of entry into our systems. And so when we have those opportunities, when there is a moment of clarity, when there is a moment where they're getting other services, is there an opportunity to be able to intervene there? Right. Have we missed that opportunity? I think sometimes about, I don't want our jails to be the entry point for people's care, but for some people, it ends up being a place where...
As long as things are coordinated.
It ends up being a place where they, are not experiencing the highs of a drug, and they can say, I need help. Right. And so one of the things I look at is from a system perspective, we have right behind the jail, there's the I think it's a well space, and it says on the door, by appointment only, no walk-ins. And we have 600 people on the wait list who want substance use services. So they are in the throes of their addiction and have said to us, I would like some help. I want us to be able to do some things so that we are not making people wait when we have that window, because when we do, we possibly get them in the next manic episode. We possibly get them in the next. They're not in the throes of complete divorce from reality always. And I want us to be able to spend some resources to get them in that moment and be able to figure out how we can serve them and keep them served. And I think that's where the home healthcare workers come in. This needs to be wraparound. I am a big fan of housing first doesn't mean housing only. I'm not throwing you in a place and going, good luck, I hope you're not out on the streets. It's how do I get you all the services you need? Because for those folks, let's be honest, it's probably not going to be job training. Some of them are beyond the age where they're going to be working again, and some of them, their disability
or there's other issues that need to be addressed before they can even get to that.
Exactly, and that may not be the ultimate goal. So it may be that they're on Social Security disability, and we need to find a way to be able to keep them stabilized, because that is their disability is so significant that they're not able to work. And for some, it may be that once we get you stabilized, you can, right? Yeah. But it's a plan that we put together that is tailored and individualized, and that's going to take more resources. And so those are the people where we're going to spend a lot of money per person, but less than we're spending right now, because we're spending a lot and not getting outcomes, and saying, how do we come together as a system to be able to provide support for this person? And then we take the next tier down, because those are our hardest to reach people. And so they're going to take the most coordination, the most support, and the most ongoing learning. And we keep tailoring it down, and we're working together on those goals. And so everybody needs something different, but it allows us also to be able to be better working together, because as much as the problems are them, the problems also are, sometimes we get people and then they hit a roadblock, or they have to have a lot of executive management to be able to navigate our systems. So we're taking people who we know their brains are not in a place where they can do all of that. And we're like, you need to be here between 12 and 2. Right. You need to fill out this form and track this email and answer this phone call. And they don't have regular access to charge their phones. And they don't have regular, and so how do we streamline that part so that we actually can get the best outcome? Yeah,
I'm glad you talked about collaboration, because I think that's one of the, not the only thing, but I think that's one of the things that we've been missing, especially over the last 5+ years. We're in this divisive environment that's either all this or all that, not what part can you do? What part can I do? How do we work together? How do we coordinate this so people get the services in the most timely manner? I used to always tell people when I was still working in the police department, if somebody came to me today and said, I've hit rock bottom and I'm an addict and I've been an addict for 10 years, but I've hit the bottom and I want help now. I literally wouldn't have been able to help them.
Yep.
Like, you're on a waiting list, maybe in 6 months. And and I used to always say, like, this person needs to get in a car now and be taken to those services now, not handed a card, hey, call on Monday between 9 and 5, because on Monday, 9 and 5, I'm not in that space anymore.
No.
Now I'm back into my stuff and I'm out on the street. And so I always, I grew up in Oak Park. So I grew up with people that spent many, many years in prisons when we got older. And those that are still alive, we're all in our 50s now. So the vast majority of them that are still alive are out now, and they're doing great things. And then I've met many people that served significant time as an adult that I didn't grow up with, that I'm friends with now. Yeah. And I guess initially it surprised me. It doesn't surprise me anymore. It's not that they're not critical of the criminal justice system. It's not that they're not critical of their time in custody, whether it's at the jail or in a state prison. But to a person, most of them say being arrested and doing some sort of time is part of what changed their lives. And yet I hear from a lot of people that, like, cut that part out. And I'm like, well, but the people that actually have the lived experience are saying that was part of them changing their lives. So I know one of the things, and we'll get to this at the very end of how people can go to your website and look at your priorities, but is the whole issue of community safety. And you mentioned this earlier, that we've kind of had our little disagreements in the past, even if it wasn't directly to each other.
Yeah, it was all my policy.
But you in the past, and I don't know if I'm using the right term, but have been critical or advocated for defunding the police department or taking money from the police department to give to something else. So talk about what as if you were mayor, in regards to public safety in the city. That's pretty much the police department and the fire department, but fire department's a whole different issue. But specifically police, what is your, what would be your, mission or goals in regards to the police department with budget? And we'll get into our budget deficit in a second, but just talk about what your view is on the police department and that whole issue of budget and what they do. You mentioned earlier a little bit about they do more than what they probably should be. And I agree with that 100%.
Yeah. The code enforcement, right? Because after 5 o'clock, code enforcement's not working. So now police are doing code enforcement. Why is that? Right? Exactly. Yes. So, yes. So very much, and I'm going to use a healthcare example because I think we all understand this. I think the way that we have approached public safety writ large is like, hey, we have put all this money into our emergency department. Emergency departments are crucial. But I think most of us don't want to end up in emergency departments, just like most of us don't want to have to call 911.
Right.
And so when that's our main approach, then it means we miss out on these upstream things that we could do to also be able to complement that, because I want an emergency department. I have been taken to them when I have had emergencies and I want somebody to help me out, right? And I also want to not be there regularly. I don't want to know any of those nurses by name. I don't want a frequent flyer card. I don't want to have, 10 stamps at the coffee shop, that's across the street. So how do we do that? And so what I'm thinking about is, how do we approach public safety? And I know when you were, the chief, one of the things we set up was the Department of Community Response. And we've talked about how we created it, but we didn't set it up for success to actually be able to do this. I'm seeing LAPD, right? Last year came out with this list of 28 calls that they said, look, these are probably the calls we shouldn't be responding to, and somebody else should. So this concept is coming up where we're saying, look, all of this is part of how we do things, but we, because again, knock on those 25,000 doors, what I heard from people is the response times are going up, or when I call, people tell me, well, I can't come out for that because that's not a priority. And then when we're looking and we're seeing that like 30% of the calls that our department is responding to aren't criminal calls. Why are we giving you that task? Why are you doing code enforcement? Why are you doing some of these things that are not your job? Could somebody else be doing them? And so when I talk about shifting money, or as it used to be referred to as defunding, what I'm really talking about is not saying there's not going to be somebody who responds when you call 911. I'm saying, if I call and say my ankle is broken, do we need a fire truck to show up?
Right.
I'm saying if I call and say, my neighbor and I are having a dispute over this thing, do we really need a police officer for that? Or could somebody else show up and say, hey, like, none of us have a gun. We're not trying to shoot each other, but we're in we're in an argument and I need some help. And a lot of times people are picking up the phone and calling us for help. And I want to make sure the right person helps. But I also want to think about how many of these things could we prevent? And I think when you were talking about everybody jockeying for like responsibility for those 2 years without the homicides, it is a collaborative effort. And I want people to, I want fewer people to be shot, which I think did happen during that time. But I also want, nobody to die.
I want nobody to be shot.
Exactly. I want nobody to die and I want nobody to be shot. And so it shouldn't have to be either or. It's like when I think about a public safety department for the city, I think about how much are we investing in the people who have ears to the ground and who are going to roll up on somebody and say, please don't shoot him. I mean, they'll say it differently,
but
right?
what is the so me when I was police chief, this was one of my big concerns when it came to things like that. Because I am and was a huge advocate. I too believe the police department handles things that they shouldn't, and they aren't the most equipped. There is somebody better equipped to handle certain things. I guarantee you, the vast majority of police officers don't enjoy handling homeless issues.
And when I've talked
but
to
there
them,
are
they've said
violence
no.
included in those. So there's times where I think they do need to be involved. But I guess for lack of a term that I've heard, but what is the transition? So when you talk about like, they're not the best person to handle that, like maybe a DCR is, except DCR isn't large enough, or code enforcement isn't large enough, or they don't believe in working after 5, or whatever those issues are. And that switch doesn't flip today and tomorrow you have enough. So right now there's whole communities that their whole response to anything in their community is the police department. Like there are this is a huge generality, but the impoverished communities use the police department for everything. The wealthy or middle class communities only use the police department for the most critical, most dangerous things. They call their doctor for kids' mental health issues. They call their doctor or rehab facilities if their kids get, the poor communities call the police department for those things. And so our vision or our goal could be for that. But the reality is today when it happens, it's these entities that are established. So what is that transition period where because I think part of our issue with DCR is we did say the police department's not responding to this anymore. Only DCR is, but DCR wasn't able to respond. So now you're leaving certain communities with no response now, which is even worse than the police department responding to things that there might be somebody better equipped. And the other communities, I say this all the time, the wealthy communities, first of all, they don't see any police officers now, right? And so if we take large chunks of money away from the police department without having something established to take that workload, the wealthy communities just get on the phone and make a phone call and they have their response.
Exactly.
The impoverished communities don't have that contact to call.
And that's exactly why, when we were talking, one of the things you talked about is like setting this department up for success. What does a transition look like? It's really very similar answer to when we say we're really reaching the limits of people's patience when it comes to homelessness because we haven't done. So like we're reaching the limits of, we can't just say, hey, somebody else is going to do it. We also have to put a plan in place. When are we transitioning these calls? How do we make these decisions, right? So that when someone calls in, whether it's, do we have enough of the 911 operators to be able to do what we're talking about? Like, who are the staff? And for me, I really said, I am agnostic about I'm not ideologically committed to, it has to be, the money has to go here. I'm saying, I want to get to outcomes and I want us to figure out how to work together. And so that means that we probably need some more 911 operators because that's the 3 numbers that we are
even under the current system. You'd need more 911 operators.
And then we need to be able to say, we need to be able to have the series of questions. And again, this is not my expertise, but like, does somebody have a weapon? Is your life in danger? Whatever those first 2 questions are, to be able to say, okay, great. can you hold on for a second? I'm going to transfer you over here and then we can have a longer conversation, or I'm going to this, that, and the other. Like, is there imminent danger, or are you calling me because you need some help and we need to talk through this? And who's the right person to respond? So it starts with, do we have people to be able to even do that triage? And then the second part is, how do we decide, right? Because an example, there was, I was reached out to be able to respond to, there was this incident where a gentleman was attempting to break into 2 homes, 2 different days, early July, and police were called, but no crime had been committed, right? They were just kind of outside. So they were given that trespass order where, hey, you have to leave. If you come back, it'll be a problem. And that for many people, that feels like, okay, you're telling me to wait until I'm in danger before we can do something.
Yeah.
And so could that call then have been, could that after the police did the initial assessment and said, hey, you have to go here, could somebody else have shown up, right? And handed off that call and said, okay, look, a crime hasn't been committed, so law enforcement has done our job, but you may have some substance use issues. You may be having some mental health issues, maybe have some housing issues. Is there someone else who can come up and triage this so that I don't have to wait until you're inside my house about to possibly hurt me before now I can get some help? And I think that for me is public safety. You know what else is public safety? The fact that this year we've had more people killed and severely injured in traffic accidents than shootings. Yeah. And so when I look at our city budget,
and that's not the first year that's happened. I mean, traffic has been amazing. Sacramento is usually at the lower end of more accidents. Yeah. The higher end, I should say.
Accidents. Yeah. And so when I think about public safety, when I say to you, all right, be safe when you're heading out, I mean, I don't want you to get mugged or shot.
Anything.
I also don't want you to get hit by a car.
I want you to come home the same way you left.
Come home the same way you left. And so we also have not invested dollars in our transportation infrastructure to be able to get down matches. So there's a Caltrans grant right now where we could have $10 million to address some of those really high injury intersections. Sure. But we don't have the 10% match to be able to draw down because we haven't thought about our investment. So what I've been concerned about is we keep giving the money to the police department, and we're not actually saying, what do we need public safety overall? And is this the best place to spend this money? Because I've been very clear. I have not said, let's lay off any officers. What I have said is, could we, when we had the 100 vacancies, could we transition those over to DCR and come up with a plan for just transition? Could we shift some of these things so that instead of you having to work your whole job and then do 10 hours of overtime and be burned out and stressed out and dealing with all the things? Because from a public health perspective, you know, we also know the data on officers, right? In terms of their mental health, in terms of, right? And so I want a healthy workforce. Right. And then I also want us to be in a place where we're not fighting with the community. Like right now, the police department is not meeting with the Community Police Review Commission. And there's all these, and I'm like, if we can't sit down and have conversations, if we can't bridge these divides, we're in real trouble.
Well, and I think that's another outcropping of the divisiveness, right? Like people eventually retreat to their foxhole. Mm-hmm. And then just start lobbing grenades to both sides. And I'm like, we're never going to get anywhere like that. And on the budget thing, I think part of the exploration has to be is, like you mentioned, the vacancies in the police department. Is that funding for vacancies in the police department funding something else that's not budgeted publicly so those sort of things. So,
and can we know that so we can know? Because
exactly.
And honestly, like I went into this, I want to be transparent because I'm so glad we're having this conversation. I feel like today is the day of transparent conversations. And so I want to be really transparent that there were times where in my advocacy, I was also acting out of my own personal hurt, right? Because, you know, I felt like we're at the table and then things happen and you were very, very honest about like, this shouldn't have happened. And then I was like, I actually wasn't a party to, because I wasn't arrested. And so I wasn't a party to the lawsuit with the city, in part because I do feel my needs have been met. You know, my family was like, you should do it. And I was like, no, I actually want I want this system just to apologize because something wrong happened here. And I just want to have the conversation. And instead my case was closed. This is after you were gone. And no one ever reached out. And I'm like, all I wanted to have was a conversation. And I feel like there's something really broken in a system where we can pay out money before we can just sit down. I was like, I will sign whatever you want, that I will not use whatever this conversation is to come at you. I just want an acknowledgement that this didn't have to happen, that it was harmful, and that I want us to figure out a way to not have this happen again, right? And so I feel like when I hear we're not sitting down to have these conversations when we don't agree, it goes back to that earlier moment of like, how do we get anywhere? And so I have been frustrated, and I have said, like, you know, the big image that a lot of people are trying to circulate and saying I was disrupting the city council meeting actually wasn't. It was when the officers came in the front, when people started yelling and had their batons out, and I stood on a chair and I said, put your batons down. You are traumatizing people. Right. Of course, the image looks like me yelling at them and I disrupted the meeting, but I didn't. I was the first comment and I sat down. But I was like, this is not making it better. This is going to be everybody's image is we've gone through metal detectors. A lot of people here are hurt and are hurting, and you're standing up front. You're the only ones in here with weapons, and all people were doing was shouting, and now you have your batons out. Put them down.
And I think that, I think that is the outcropping of when we don't do those things. Yep. That's where it leads, because those officers standing there with the batons could say, I would imagine the same things. Like, I'm fearful for myself. That's why I have this baton. Yes. Because it's devolved to this point where nothing's really good. We're just yelling at each other now.
But they they actually stopped,
and at times
and they stood down, and then the meeting started again. And so I think it's really funny that people are like, she disrupted this meeting, when actually I jumped in when the meeting was disrupted, and I actually got us to a place where we all calmed down and the meeting was able to proceed. And so, you know, some of what I see and I experience is both what I could imagine working in a system, which is a frustration of, like, I get up every day, I'm not actively trying to cause harm, but people really don't like me, and I just feel like this is a no-win. And also the other side of that, feeling like I wish things would be different, and I wish we could actually sit down and have these conversations, and I want us to admit. And so when I see us fighting over, is our police department experiencing racism, I was like, welcome to America, Jack. This place is on stolen land and with stolen people. Yes, we have racism problems. That's true for medicine. That's true for education. That's true for everyone. It's not personal, police department. This is where we live. And so if we don't admit it, we also can't address the problem.
I've been told we've evolved past all that. But
we're a post-racial society now.
That works. So last question on the police department. Recently, the governor of California put out an executive order that I didn't read the whole executive order word for word, but I think many people are taking from that is now that is what frustrated people are taking as, oh, we have some new hope, because it has now enabled the police department to take enforcement action. Mm-hmm. So I guess my last question on the whole issue of homelessness is, what are your thoughts? How do you feel about the executive order from the governor?
I don't love it. I got to be honest.
And why is that?
I don't love it because I think it makes it harder for us to do that first part when we're talking about reaching out to 150 or 200 people, and then the people beyond them and the people beyond them. Folks on the street are scared, and they already feel like they don't have a lot of protections. And I know that some people are saying they have more rights than we do because they can do that.
That was going to be my next question. There's people that live in the community or have businesses that can say they're scared too.
And rightly so. And I like I said, I really get it, because I woke up with someone in my backyard the other day, and I was grateful to my neighbor for saying, hey, did you give this person permission? Because we gave her a blanket and a pillow, and she seems to move to your backyard. It was 5-something in the morning. So I'm glad I did not step outside and have a heart attack. And it ended up being fine. She was fine. I gave her water and thing, and then she left. But that's a scary situation to come outside and not know what I'm walking into, right? So I am, like I said, I think what we're doing isn't working for anyone. And also, we have to recognize that vulnerability comes in different spaces. And in the same way that we all can feel vulnerable in a space, you know, some of us feel more vulnerable. And I think the folks who are unhoused, who often, you know, are experiencing other challenges, 60% of them have chronic conditions. So whether that's a physical condition or a mental health or both, that means that, you know, it can be difficult to manage life, and to know that you don't really have protections, and to know that, you know, now there's this imminent threat. It creates this stress response. And so when we're going out and trying to reach people, now they're worried that they are going to end up, you know, in jail, or end up, and it doesn't create the trust that we need for people to tell us what's going on and to be able to move forward. I don't want people sleeping in front of someone's building. I think housing is a human right. I think housing, clean air, clean water, food, right, clothing, those are all things that we need as humans. And so I want to get to a place where everyone has it. And I also want to make sure that when we pass things, we're not being expedient and doing something quickly that makes things worse down the line. And that's what that executive order felt like to me. It also felt a little bit like we're worried that Republicans at the national level are going to come for California because we are the liberal bastion of the country. And we now have a vice president who is a major presidential candidate from this state. And so we're trying to do that quick cleanup that you do when somebody calls and says, I'm on my way over, I'll be there in 10, and you start shoving stuff in the closets and you're not really cleaning up. That's not, your house is still dirty, but you're doing a surface level thing so it looks good so that people can say, see, we're doing something about this. This doesn't feel long term, it feels short term. And as a public health person, sometimes you got to take the time to do it right so that it actually leads to long-term success instead of trying to get short wins that will ultimately end up backfiring and making things worse.
So in terms of the police department specifically, I think, so again, it's the November election is down to two people.
Yes,
you
it is.
and
Yes.
Assemblyman Kevin McCarty. And I believe I've heard him publicly say, and I think it's on his website, that he has promised not to cut police funding.
Mm-hmm.
So if I'm a resident or a business owner or a voter, I guess you could say, in Sacramento, what does that say? And I don't mean to ask you to speak for somebody else, but
sure.
What does that policy kind of desire? What is the difference between that and you when it comes to me living in the city of Sacramento or doing business in the Sacramento or visiting Sacramento? Those are two, what you've just described is you're open to doing something with the budget. You haven't given like a specific and said you're open, but like one has said, I will not cut the budget of the police department. And so what does that difference mean for somebody in the city of Sacramento?
Yeah, I think that's a politically expedient answer, right? It's the same thing as we had two other candidates in the primary who said, we're going to hire 100 extra officers. And I'm like, with what money? With what academy recruits?
Right.
Like, I think the reason why, to go back to your other question, that we did so well is because I'm not here trying to lie to people and tell them things that aren't going to happen. I'm trying to be honest with people about the timeline it's going to take, and I want to bake that into the goal. So what I'm saying to you is I consider myself the fund public safety candidate because I think public safety is all those things that we talked about. And so I'm trying to right size our investments because we have, 4 years ago, our police department budget was $156 million. This year's budget is $250 million. So we've invested $100 million more in this department. And yet, when it comes to outcomes, that may not have been the best expenditure of those dollars. How do we make it so that we have all of the money in public safety that's working towards goals? That's what I want to have. And so that was one of the questions I asked when I was on Measure U is like, how do we know what these investments get us, right? What does 10 more officers get us? What does 10 fewer officers get us? Like the $90,000 that we're putting into, sex trafficking prevention or where does that get us? So we can figure out what's the best place to put our dollars, because there was some element of magic happening between 2017 and 2020.
Well, and I'm sure part of that's contracts, right?
Yes.
So they didn't get anything extra. They just got a raise, and that's a good portion of that increase.
And we got that raise, and then we were told about the budget deficit. Would we have made those same decisions had we known? Because now we're in a position where we're talking about cutting RT and cutting so I want us to be making decisions with the full understanding of at the end of the day, we live here. We care about this community. I don't think we're talking about villains. I think we're talking about deeply entrenched interests. And I'm trying to get us to take a step back and say, what's good for the goose is good for the gander. And so I have been clear that I would like us to get back to a police department budget that was similar to right around before Measure U got invested. Because part of, I think, public safety is, do people have jobs, right? We know that when people are unemployed, crime rates go up. When people can't afford to live here, crime rates and the problem of homelessness. So how do we think about our city as an ecosystem? And so that we're investing in ways where our police department can do full-time effort, and also our violence prevention folks can do a full-time effort, and also our transportation folks can do a full-time effort. And when I walk through the community, I feel safe, because I think that's what people want. And so I'm not trying to tell you police because you have been told police equals public safety. I'm saying I want to invest in public safety. And I think you and I both know that that's bigger than just the police department. Absolutely. And I also think, quite frankly, it's weird because it's seen as this pro-police position to say, I'm going to keep giving money to the police. But it's also continuing to make them the only ones responsible and setting them up for failure. And I actually think that that's mean to our personnel and counterproductive to our goals. And so we're setting them up to be the scapegoats for our other systemic failures.
Sure. And I think that's where the looking at things holistically comes in, because if you don't give a raise, does that mean people leave and we're way lower paid than other police departments? So like there's so many moving parts, which again, I keep saying this, but like the divisiveness takes away from understanding the whole issue. And I don't think there's anything throughout history where division was the best path. And I see us do this too many times, not just in Sacramento. I mean, it's all, I mean, we're very divisive right now, and we won't get into the reasons for it. But last couple questions.
And that's why I'm going to be calling you, asking you, all right, so you've been on the inside.
Well, anything for Sacramento, I'm always down for.
How do we do that? Like, talk to me about what a transition looks like. What are your concerns about this? That's the exciting part about this job, honestly. It's a little wild, but the exciting part to me is that I don't have to have all the answers. I get to ask the questions. And other people get to tell me what they know and talk to me about, and we get to come to the table. Like that part where we get to come to the table and we may not all agree on everything, but we're able to figure out what we can agree on, how we can work together. That's the part that gets me up in the morning and gets me going.
And I've always been more willing and always will be willing to work, whether I agree with everything somebody believes. If they're working for the betterment of this city, I mean, the Oak Park community, my mom saved my life. So I will always do whatever I can to help this community. But the city budget is a big part of what this city can provide to their residents from government anyway. As you said, I agree that government can't provide everything. We all got to be in this together. But this last year, I think it was a $66 million deficit. I've heard repeatedly that next year's is even worse, and we used one-time money this year to help solve that problem. I've heard $77 million. I've heard more than that for next year. So if you were elected mayor, how do you deal with this budget deficit that we got through this year without too many cuts, if you will, but like, again, we used one-time money to get through some of that, which isn't there next year because we used it. So how do we get through this huge budget deficit that, there's a lot of cities dealing with a budget deficit, but there's also cities that aren't.
Well, first and foremost, necessity is the mother of invention. And so I think that there are some conversations now we have to have that we wouldn't have if we were at $100 million surplus, right? In the same way that I think we missed out on an opportunity at the state level when we had $100 billion surplus and we were just making it rain in the club every day. Oh, you get money, you get money. And now we're in a deficit. And it's like, could we have spent those dollars a little more strategically? So I'm hoping that in the same way that I was hoping during the pandemic that we would start to rethink work and we would start to rethink, how we structure our healthcare system, because it seems like a bad idea when we have to shut down businesses to have your healthcare tied to your employment, right? Like, I'm just hoping that out of the crisis comes an opportunity for us to rethink some of the things that maybe
some of those aren't directly under your purview as a mayor.
Of course not. Of course not. I'm just saying in general, like there's a saying of don't let a crisis go what is it? I don't want to say exploited, but
I know.
But it's like, and I don't want us to be in crisis, but also this is where we find ourselves with less money than we were hoping to and with a deficit. And so now we need to have the big picture conversations of where is the city going? How do we maximize revenue? Because one of the things I've talked about, and we didn't talk much about economic development here, is, we invest dollars in Golden One and these public projects, and like not all of them are vending with local businesses. When we go to Golden One, we spend $17 on a beer that's usually Heineken or Budweiser, and nothing against them, but we have Track 7 and Oak Park Brew and all these other places where if we were spending $17 on that beer, we'd also be investing in jobs and their distilleries and breweries and the ways that those dollars can turn over in our community. So now we're going to have a conversation
on those sort of things. Are you talking about like city requirements or ordinances that require that sort of thing, or how do you talk about to get to that?
I'm talking about prioritizing where our investments going and making sure that the dollars, one of the economic like measures I want us to look at is how many times does a dollar turn over in the city of Sacramento before it leaves? And how can we, literally play a good game of ping pong where the dollar just keeps going and keeps, how long can we keep it in the air?
I think back to Black Wall Street and what they said about how in Black Wall Street, how that dollar did exactly what you're saying.
Yes. And I think we have an opportunity now to talk about that, because we're not just going to get out of this deficit just by thinking about how do we cut. We also need to be thinking about how do we maximize revenues. And that has to be an important part of this conversation.
And do you believe that the business community, because of taxes and all those sort of things, are part of that mix?
Yes.
Like if we lose a lot of businesses to the Folsoms, the Rosevilles, because they're like, I just don't want to deal with this stuff that goes on in this city.
Yeah.
That too is detrimental?
Absolutely. And one of the reasons why, I thought instead of forcing all of our state workers back downtown, I'm glad that the Downtown Partnership and other places are having conversations with Sac State and with UC Davis about, could we bring a campus downtown? So we have young people living downtown, because I've been joking about this a lot, that we all know a lot of the businesses and restaurants close at 3 or 4 p.m. because that's when the state workers leave town. Young people don't get up till 2. Right. So you could have a first shift and a second shift, and now your business can make more money because these young people live here. And you know what happens after them getting their degree in poli-sci from Sac State or from UC Davis? They've lived down here for 4 years, and now they're trying to work at the Capitol, and they're looking downtown to be able to find a place to live. And so if in the process over the next 10 years,
over the years,
right, like we can get more of that missing middle housing built downtown, now you have young people who started out in college downtown in a dorm who are now living downtown as well. And so you're thinking about the future. It's still taking advantage of the fact that we are the state capital, and our competitive edge over Berkeley and Stanford and USC and UCLA and San Diego is like, if you study poli-sci here, you could bump into the Secretary of State on your way to class.
Internship.
You can do internships.
And that's been a big issue for our city since I was a kid, like being a political town. We've been trying to diversify our economy so we're not so reliant, which I think COVID was another reminder of that. When COVID shut government down, like it destroyed the city, as opposed to other cities that have diverse economy that are able to, okay, this economy is down, this one's not, sort of thing. So
Pittsburgh went through that. Because
I'm sure a lot
I was
of
born right into the time after the steel mill,
yes.
When we were a one-trick pony. And now I look at Pittsburgh and I see us in all of these different markets. And so I think Aggie Square coming is another example of that. Like if we can get some businesses in Aggie Square that are thinking about innovation, especially when it comes to storage of solar energy and some of those cool things.
Comes the way, I always say vision is one thing and operationalizing it is a whole nother thing, right? Like you can have the greatest intentions, but if it doesn't ever come to fruition, it didn't really mean much. So
we need innovation.
I want to close on this and give you an opportunity to close on whatever you think, especially folks that are going to vote, but also the people that aren't voting, the people that either can't vote, whether it's because of their age or other issues, or just choose not to vote. I mean, I think we have a growing group of people that are just so frustrated. They're like, why vote? Right? And so what would you like them to know about Dr. Flojaune Cofer that's running for mayor of Sacramento? And then also, if they wanted to get more information, maybe your website or however they can find out more of, because we haven't been able to cover everything that's the things that you believe in and would champion as mayor. So floor is yours.
Yeah, thank you. I thank you for having me on. I've really enjoyed this conversation, and I think it's nice to have a long forum to just be able to talk about our feelings and our hopes and our goals and our frustrations as well. What I would say to people who are feeling like they don't want to vote or they're just so over it is I overstand. I don't just understand, I overstand. I feel the same level of frustration, and what you do with your vote is your choice, for sure. And I am not here to bully or badger anybody into participating in something. Sometimes we all need a break. Sometimes we need to take a step back. I'm also inviting people in who may have felt that frustration to try to give us another shot. And I know that is every election we're told, this is the one, and this is important, and this is this. And so I'm not going to give you that hard sell. What I'm going to say is, I need your help. What I'm going to say is I'm not going to fix it all by myself, but I think we can do a lot together. And what I'm trying to do with you is to build a structure where your voice matters, where you are involved in the decisions, where you have a way to be a partner in our success, and where we actually value your contributions. And that is different. I want to transform the how we do things as much as I want to transform the what we do. And I think that is different from the approach before, which has just been focused on what are we going to get done and how quick, and I want to get to the how do we do it so we can get things done, not just now, but long term. And we can really think about how we invest in ourselves and how we create community and which one of these structures aren't serving us that we need to really seriously rethink. And whether that's going to our state or to our federal government and saying, this is not working for us and we got to figure something else out. I want us to be having those kind of really deep, important, foundational conversations while we are improving our community. And that's what I'm inviting you into. I'm telling you once again, we're not going to agree on everything. We never have. We never will. But I still think we can work together. I still think we can find a way to infuse love into our government, which is not a conversation that we have often because we don't think about it that way. But we are human beings. And some of the problems we have are because somebody's feelings got hurt, because somebody didn't feel valued, because somebody didn't feel loved. And if we keep overlooking that, sometimes we look to the law or to a policy when an apology will do. And so that's the kind of leadership and spirit that I want to bring to this city, is not just this dogmatic focus on how do we pass policies. It's also how do we build community? How do we build trust? How do we engage in conflict resolution? How do we build across bridges and divides? Because I think a lot of us are frustrated with the fighting and with the partisan nature, especially of our federal politics. And I think we can have something a little different here because I don't think we're that far apart from each other. And so that's what I'm inviting people to be a part of, whether you live in the city of Sacramento, or as I say to many of you who are like, I don't live in the city. I'm like, we're part of a region and some of our problems don't know boundaries. Some of them do. So you are part of this region and this is a regional position. And so I invite you to be a part of the campaign. I invite you to reach out and have conversations with your neighbors, because November 5th is the beginning. That's the start line. This is as they say, the light work, as the kids say, right? The heavy work starts on December 10th when we get sworn in and when we start really working together. And so we are building up people who are willing to have these conversations and are willing to get in the trenches and are willing to reach across the aisle to be able to do this work. I invite you to be a part of it. flowformayor.com is the website. You can find more information. You can get signed up. We have committed to 22 mayoral forums between September 5th and the end of October.
Both of you have?
Lots of,
okay.
I've committed to them. I think Kevin is like making sure he has all of the dates there. So we're putting them up on the website. Good. We are like, you'll be able to hear from both of us. We invite you to ask us the hard questions, to push us, to tell us things, share information. My team is processing things and thinking about how we can approach and answer questions. And that's what you get now is what you're going to get as mayor, which is an open door, a willingness to sit down, and a willingness to build with you. And I think that's what we need in this region. And that's why I'm asking for your vote.
And hopefully people will watch one or more of those so then they can judge for themselves, right? Who they think would be best serving their city. And I forgot to ask one question, so I apologize. Want to ask one more question. You touched on this earlier in regards to the, so I think I might know what your answer is, but about Strong Mayor. So Kevin Johnson put forward Strong Mayor in 2014. Mayor Steinberg put it forward again in 2020, and he called it the Mayor Accountability and Community Equity Act. And he said his reason for putting that forward was to move faster in addressing the homeless crisis, which we've talked a lot about today, and uplifting disadvantaged communities. So my question is, do you feel we need to be a strong mayor? And sometime in the future, would you consider putting forward another bid to become strong mayor? Because I continue to hear about how if you're a large city, you need to have a strong mayor. So I used to ask people, what about Oakland do you like to be about? Would you like to mimic? What about San Francisco would you like to mimic? Because they're strong mayor cities and they face some of our challenges and some more than we have. So
I think the question has been asked and answered by the voters, so I don't have an intention to bring it back. I can't say what the mayor after me will want to do, but during my time, that is a commitment I'm willing to say on the record is I'm not trying to bring strong mayor back. And the reason why is because I actually hate the framing of it. We do this thing where none of us wakes up in the morning and goes, I hope to be weak. So, of course, weak mayor is a bad system if we call the opposite strong mayor. And I actually don't think that's an accurate representation of these two systems. I think we have a collaborative mayor versus an executive mayor. And there are pros and cons to each. An executive mayor can make decisions quickly and by themselves. And that can lead to things moving quickly. But we all know that saying, if you want to go fast, go alone. If you want to go far, go together. And that does not make fast the enemy of far or far the enemy of fast. Sometimes we need to go fast and sometimes we need to go far. And so we choose a different tool. I think as a city, we want to go far. And I think that if we want to go far, we need to collaborate with one another. And we always say, that success is many parents and failure is abandoned or an orphan, right? And part of that is because when you have that executive mayor, then you can get things done, and then they can also be short-lived, because as soon as that person's gone, they didn't have to build buy-in for it and really, move through systems and structures and make sure it's going to work. And so, yes, you can get things done quickly, but they also can be short-lived. On the see executive orders and things like that we're seeing our governor use that executive power. The other side of it is, yes, it takes more time. And yes, you have to build consensus. But it's so much stronger and so much more long-lasting when we actually come together and do it. And as a public health professional, I actually see that as a strength. One of the things we learned early on, at first day of public health school, the professor says, so you are now responsible, you're entering a workforce where you're responsible for the two most important things to our entire species of human beings: the number of years in our life and the quality of life in our years. And by the way, you have no authority and limited money. Good luck. And we all go, is our tuition check cashed already? Like, can we get a refund? I feel like I just got set up for if you had told us that on the brochure, half of us wouldn't be here, right? And then he laughs because he can see the look of sheer terror on our faces, and then says, that's a little bit of an overstatement. Yes, you do have some authority. There is public health authority. And yes, you do have a little bit of money, but you don't have much of either. And so your job, and what our job is over the next few years, is to teach you how to collaborate with people, to teach you how to come to someone and talk about where the two circles overlap and how we can work in that, to get the transportation industry to understand that if they do certain things, it can be good for air quality and also for their operations, to be able to make financial arguments or personnel arguments or, whatever argument you need to be able to align someone else's interests with yours so you can get more done. Because you're not going to be able to come into hospitals because you don't have authority over them and tell them what to do. You're going to have to build a partnership and encourage them and work with them to get things done. And I think that's what our city needs. And that's why I'm excited about the collaborative mayor system, because I think when I can get 5 votes or 9, we can get a lot of things done. And I think if we use the right structures, we can also get our staff working in the same way. We can stabilize some of the deep issues that have been happening in the city with things moving all the time and really work towards some goals. And I think we can create job satisfaction for a lot of people working there, because now we get to see the fruit of our labor and feel appreciated. And I think there's a culture change that can happen when we find ourselves working together. Humans are not solitary creatures. No. That's why when Tom Hanks was on that island alone, he created Wilson. We need each other. And so I think the more we can build that into what we're doing, the better it can be. And yes, the downside of that is it might move a little slower. But what can we get done together? That excites me.
Well, I love the together for sure, because I think that's how we do move forward in the best possible way. Yep. And I just want to say thank you so much for your willingness to come on here and speak, because I think that's the key for so many people similar to me that love the city so much, might be frustrated at times, but need information to be able to make their own decision on who they think is the best for their city. And it's conversations, willingness to have conversations like this, or the 22 and the 22 different opportunities people will have to see both of you together speaking about the same things, I'm assuming, and so they can make a decision who they feel will be best for their city. And I don't think Sacramento is terribly different than many, many other major cities across this country. Many are facing similar challenges, as we can watch on the news every day. And as I used to say all the time when I was working in law enforcement, leadership is important. Like, it's critical. It's not just this, it's nice to have. It is critical. And so thank you for taking the time to be willing to speak about your views and the future 22 opportunities people will have. So thank you very much.
Thank you for having me on, Chief. I appreciate it.